one of the first things we have to do is to define what the goal of our treatment is. And when the cancer spreads outside of the origination, for example, breast cancer going outside the breast, or lung cancer going outside the lung, our goal becomes controlling the cancer so that it doesn't cause more symptoms or problems. In broad sense, that means palliating the cancer's effect. This can be accomplished by different ways. Sometimes it requires chemotherapy. Sometimes it requires radiation therapy. Sometimes it requires therapy other than cancer therapies. And as your doctor, my job becomes how do you figure out what's best for you at each time. So for example, when someone first gets diagnosed with cancer that's metastatic or is spread, I can recommend chemotherapy. The goal of it would be to control the cancer so it doesn't spread anywhere else. It also means that it doesn't cause any other symptoms. Sometimes patients already have symptoms such as pain or discomfort like such as shortness of breath, and that may get better with treatments. Treatments, though, can cause its own side effects, and sometimes we have to find the right balance, either changing the dose or stopping the treatment. In patients where the cancer is already spread, there comes a time when I will sit down and say the cancer chemotherapy is actually causing more symptoms or more problems than the cancer itself, or that they are not in enough of a shape physically to tolerate more chemotherapy. And hospice, services aimed at controlling the symptoms only, becomes our mainstay of treatment. That becomes the treatment itself. Your cancer doctor or your primary care doctor can become the doctor for hospice, or the hospice doctor can become your doctor. And the goal here will be to provide the care that you need at home to control the symptoms. At this point in time, you're not looking at cancer treatments such as chemotherapy or radiation, but just treatments such as oxygen, pain medications. Many people think or look at this as giving up, and I want to address this head on. I don't see it that way. Once we establish that our goal is to control the cancer, to help my patient live as best as possible, and if the cancer chemotherapy is causing more problems than the cancer itself, does it make sense to continue? And when presented this way, many of my patients will tell me, the doctor, it's time to stop the treatments and let's focus on just helping me live as best as possible without those drugs, without those poisons. And that is absolutely okay.